Hey everybody, my name is Dr. Caleb Stott. I am one of the founders of Smile Now Dentures Implants. Every single month, I am, just like many of you, online, listening to people's experiences with dental implants and reading a lot of the questions that they have about treatments and what it would mean to them. And so what I'm doing right now is I've taken the top questions that I saw and that I saved, and I'm going over those so that you can understand and hear from somebody that does dental implants every single day and has been doing this for years and years and years. What would I say to these questions? What would my response be? And how can dental implants help you? So, urgent. I had 2 dental implants installed on the upper right side 2 weeks ago. One just popped out. No pain. How do I approach the dentist? So yeah, good question. That was probably really alarming, right? So you have a surgery done, it's been 2 weeks, and then all of a sudden you wake up and one of the implants falls out. So obviously that implant was not very stable in the bone when placed. It would not have fallen out had it been put in the right position or in the right amount of bone. So that's very rare, very, very rare. I can't even think of the last time that I saw something like that happen. As far as how do you approach the dentist? Well, you just call them up. You call them up, you go in, you bring in the implant, you let them know, hey, this doesn't sound right, and then you work with them on it. And that might be a situation where, after your discussion, you decide to get a second opinion, you decide to go somewhere else, and you have somebody that maybe has the right amount of experience to put it back in there and treat you appropriately. So good luck on that. I found a prosthodontist that I like. The problem is he does not offer anesthesia. I have a heart arrhythmia and some other cardiac issues and would prefer at least some kind of twilight. I don't just want to take a pill and feel out of it. Should this be a disqualification for this dentist, or is there any other way around this, right? So what this patient is talking about is, first of all, they went to a prosthodontist. A prosthodontist is a dental specialty recognized by the American Dental Association. It's somebody that goes to dental school and then goes to an additional, usually like 3.5 years of school, sometimes more, to be able to restore people's smiles. I have in my practice a prosthodontist that I work with, and so it's a specialty that I respect a lot, and they do a lot of really good work, and it's wonderful. So I think that part of this is really good. The problem is they do not offer anesthesia, right? So anesthesia basically means the ability to make somebody comfortable during a procedure. There's primarily 3 different forms of anesthesia. We do oral conscious sedation, that's where you take pills, and the pills, like what she's alluding to, will make you sleepy during the appointment. Now, I've done hundreds of these procedures just with oral conscious sedation, and it works really well. I would also say it's pretty normal, especially overseas, to use oral conscious sedation to do it. However, at Smile Now Dentures and Implants, we also do offer IV sedation or even deep sedation with nasal intubation. And that's because not everyone's the same. They have different backgrounds, they have different desires. And this patient, especially with heart arrhythmias and cardiac issues, yeah, these are huge concerns for an anesthesiologist, especially depending on what they've gone through. If they truly do desire it, I'm sure that there's options to find that type of treatment. And if this prosthodontist doesn't provide it with the treatment that they're doing, you just might want to seek out a second opinion of somebody that can offer the different levels of sedation so that you can be most comfortable for this procedure. And I would say that there's absolutely some people that need deeper sedation for this procedure. Some people can get through it. It just depends on your disposition. It depends on the amount of anxiety that you have going into it. It's up to you whether or not this is a disqualification for this specific provider. If you want to look for other options and have deeper sedation, it definitely exists out there. You just need to find somebody that can do it for you. So I need help. I'm very frustrated. My husband got his dental implants in Turkey, and now they've become loose over time. And he's gone to 2 places so far, and one place wanted him to redo all his dental implants and want to charge him $27,000. I think this is outrageous, and they're trying to take our money. We're gonna try one more other place, but this is ridiculous. Yeah, my heart goes out to you in this situation because it's really difficult for these very large treatments that require lots of expertise. The materials that we use are not cheap. The materials that we use are medical grade. They cost a lot of money for us to use them. And then there's other parts to this, bone grafts, getting rid of the infections, doing everything. In America, I would say that the average for this type of treatment can be anywhere from $40,000 to $60,000 to do both the upper and lower. And for some people, without financing, it's just not as affordable. So what we'll see a lot is we'll see a lot of patients that end up going overseas, doing dental tourism or medical tourism in order to get it done. I've had patients that have gone to Mexico and we had to to end up redo their treatment because the implants were not placed in the right place. The implants did start failing. You started having them be exposed, and over time they did get loose and they started to fall out. I've, read cases from Turkey with similar situations, and so I think it's really difficult. You probably could find a good provider in these countries. I know a lot of good providers all over the world in every single country. However, I don't know if they're the ones that are reaching out to try to get people from the United States to go there for treatment. What ends up happening a lot of times is you pay for it once and it's not done right, and then you do have to pay for it a second time in order to fix it. And it just has to be done right if it's gonna last you your life. If it's not done right, you're gonna have to redo it. It's just the way it is. So sorry about that. I wish there was a better situation for you, maybe a more affordable option, but for the types of materials and the equipment and everything that we need to do this and to do it right, there is a cost. And I would say that it used to be that these surgeries, they would cost 6 digits instead of 5 digits. So it'd be like $100,000 in order to do this. And that was just like 10, 15 years ago. So costs are coming down quite a bit, but this might be a situation where you're better off with snap-in dentures or maybe traditional dentures rather than wanting the highest quality of life treatment and fixed if you can't afford it. I hope these questions have been beneficial. I look forward to doing this again next month, and I'll talk to you later.